Hi, Dr. Turowski here. Although nothing will replace the personal consultation that eventually will have to happen in our office, I would like to spend this few moments discussing breast augmentation surgery and my philosophy about it for the patients who come from a distance or they are from foreign countries. We have a lot of patients flying in for these procedures, so at least they will know what is my philosophy and what's my approach to this procedure. Breast augmentation is here to stay. It's been around for 50 years and really the numbers are growing. It's more and more popular. Things change over the years. We have different implants available now than many years ago, but generally it's the same procedure. It makes the breast bigger and there are certain ways that are done or used to make the results better. We have to make some decisions. First of all, the type of the implants that can be used differs. We can use either saline or silicone implants. Saline implants were available for patients really as a replacement of silicone when silicone was under investigation. This happened many years ago, and for the last 10 years or so, silicone implants pretty much replace the salines. Salines are still available, but most patients don't want to deal with them because they are not as soft and they have also the possibility of visible rippling. As a matter of fact, even silicone is different now, and silicone comes with a different densities. There are softer implants that are feeling more natural and soft, but they're also slightly tighter implants, and you can see here that some of these implants can still have ripplings and some will be smooth under the skin. So these are implants that are only available for the last few years, and they're becoming more and more popular. There are two advantages of them. One, there is less chance of visible rippling. The second is the more upper pole fullness, which for some women is important. As a matter of fact, we also can talk about who gets silicone implants or implants in general. This procedure is designed for pretty much everybody, starting 18 years old, because below 18 we really don't do breast augmentation unless it's a medically indicated procedure. But there are more and more women in their 50s, 60s and even 70s undergoing these procedures, because their lifespan expanded. They can live another 10, 20, 30 years and enjoy their bodies on the beaches and in clothes. So it's not unusual in today's world that we have a 60-year-old woman who finally decides to have breast enlargement. What's nice about these procedures is that they are really easy to go through. I've been performing these surgeries for over 20 years, have done tens of thousands by now. And I have to say that there's nothing better and more predictable from plastic surgery standpoint and from the patient standpoint than breast augmentation. From the beginning, I was really interested in axillary approach. This is something that most plastic surgeons don't perform or don't recommend, but if a surgeon is good at it, knows how to do it right, it offers advantage of having no scars on the breast. Therefore, this is my preferred way to do the breast augmentation surgery for over 15 years. It literally leaves no scars on the breast, and if it's done properly with the use of the endoscope, it can be done reliably without more complications or more risks than any other approach. Any other approach, such as incisions under the breast or through the periareolar approach, which is a small scar under the nipple, will leave you scars. The scars can be worse or better, but definitely not as good as having no scar. Therefore, as long as a woman is a candidate for axillary approach, I think it's the best way to do it. The other thing that has been helpful over the last several years is the pain pumps. This is something that I placed during the operative procedure. It's a small catheter that injects local anesthetic into the breast area for the 24 hours and allows women to return back to normal much quicker. As a matter of fact, most of my patients return to driving and going to the office works within 48 hours. The big issue is also, of course, the size of the breast, and we have hundreds of before and after photographs that you can review and decide which one is good for you. However, the big addition to our armamentarium of breast augmentation tools is a Vectra. It's a 3D computer camera that allows us to simulate your looks with different types of the breast. Still, trying the breast sizers or breast implant sizers on yourself is the best option. However, the Vectra will show you different outcomes with different sizes of the implants on your body, not somebody else's body, but on your body. So it is really helpful, and we can send you the copy of this pictures to your computer. You can show it to your family or to your friends, and they can give you advice of what size to choose, because at the end this is probably the most difficult decision we have with this type of surgery. There are a lot of issues available. I cannot spend too much time here discussing these questions, but if you have any more questions, we are able to perform virtual consultations. So you can either call us, email us, or do a Skype type of the consultation. But at the end, of course, all the questions will be answered after I have a chance to examine you in my office. For those who come from a distance, I have to tell you that you really don't have to be here in Chicago more than 48 hours. And if everything goes well, which usually does, your visit can be only for one night before and one night after, and you can fly back to your own country or state. For any more questions, please review my website, and also try to contact us through the email or telephone.